Good morning, everyone, and welcome. Today is Monday, December 9th, 2024. We are here for a work session. On a quarterly basis, we convene as the Board of Social Services, and we have a number of folks from our Human Services Department. We are scheduled to go from 10 a.m. to 12 noon. My name is John Kafalis, County Commissioner, District 1. Kristen Stevens, County Commissioner, District 2. Jody Shattuck McNally, Commissioner from District 3. We have our County Manager. And before we turn it over to our Human Services Director, Brenda, is there anything you'd like to say to perhaps cue things up a bit?
Sure. I'll just say for the public that this is a quarterly meeting you all have. You convene as the Board of Social Services for this purpose. The Board of County Commissioners in Larimer County does serve as the Board of Social Services, and each quarter the Human Services staff does come and present information to you about their programming and their community contacts.
Thank you. Morning.
Good morning. Are you ready for me to jump in? Okay. Good morning, Heather O'Hare, Human Services Director. We're going to do introductions really quick because our presentation is more of a discussion. So introductions at the beginning I think will be less disruptive. And then I did have one quick addition to the agenda. I wanted to cover a draft letter that you have before you before we go into our strategic plan update. So, but any other additions before we do introductions?
Thank you, Heather. Colleagues, do you have any other additions to the agenda? Two things I wanted to mention. I don't know if we'll have time. And it looks like this letter is speaking to some of it. I'm curious if there's any update that you or your staff or your team can provide regarding the Joint Budget Committee hearings as they pertain to human services related and child care related programs. And then the second thing, again, I don't think there'll be time. I was listening to the radio, and I'm curious if you all are thinking about, with the new administration, my understanding is that one of the ways of perhaps cutting the federal budget is to move the Medicaid program to a block grant program rather than the way it is now, and then also maybe cutting back on the Medicaid expansion program. Wondering if you all are thinking about that and, you know, what the implications might be for the state and certainly for the county. Just something to think about.
Certainly, and we can see as time allows today.
As time allows.
But we can follow up with more information if we don't have time today.
Thanks, Heather. Please begin with introductions. Or please continue.
Okay. Go ahead, Thad. We'll start with you.
Morning, Commissioners. Thad Paul, Division Manager with Child, Youth, and Family within DHS.
Good morning. Gordon Coombs, Operations Division Manager for Human Services.
Good morning. Jill Mosh, Administration, Communication, and Excellence, or ACE Division Manager.
Kayleen Rowley, Business Operations Coordinator.
Lori Metz, Division Manager for Aging and Adult Services.
Good morning. Vanessa Fuel, Benefits and Community Support Division Manager.
And then our second agenda item, we'll swap seats, and Katie and Aaron will come up and they can introduce themselves at the beginning of their presentation. Okay, so one addition to the agenda and some updates to the JBC. So our child care assistance program continues on a freeze. We do anticipate that we could be our most, I would say, estimating the over expenditures is really difficult because it depends on the age of the kid. Are they receiving part-time, full-time care? What type of provider do they go to? What quality rating that provider has? There's probably 5 different factors that determine what the rates are for each individual family. So trying to estimate the expenditures is challenging, but we know that we will be at a minimum 1.4 million overspent. at the end of this state fiscal year when it ends in June, and that is on top of an $8 million allocation. So we receive just over 8 million, and I would say the lowest we would project to spend this year is 9.4 million. I actually think it will be closer to 10, if not over 10 million. So the county then is required to cover that overspending if there isn't leftover funds at the state level. There will not be leftover funds at the state level. There are 10 counties currently on a freeze or a wait list, mostly the metro counties, the largest counties, and the state anticipates that potentially the entire state could be on a wait list or a freeze by June. So there are a lot of reasons why this is happening, but as we unfortunately thought that we might see some glimmer of hope in the proposed budget that went to the JBC on November 1st, and unfortunately there is not. Not only is there not a request for state funding for the Child Care Assistance Program, they are refinancing some federal funds, so moving federal funds from one program to another that will increase about 9 million in childcare, but then they also want to increase the county match percentage. So piecing those two things together, the increase in the move of the federal funds and more county money, looks on the surface that there is an $11.5 million increase to CCAP. The loss of the COVID-related money is more than that amount. So there will actually, in total, be a decrease to CCAP, even with the 11.5 million. So we've been talking with our county peers and across the state. We've had a lot of meetings with the State Department of Early Childhood, a lot of meetings with Colorado Counties, Inc., and Counties and Commissioners Acting Together, CCAT, as the two associations that you all belong to, about strategy and opportunities. We've had conversations with our national associations about what to expect with the new federal administration. And we have a variety of different strategies we're talking about, but one that I wanted to propose to you is sending a letter like you have in front of you in draft. When we looked at the Child Care Assistance Program budget alongside the Universal Pre-Kindergarten budget, the difference is very stark. So CCAP is intended to serve kids 0 to 13. UPK serves 4-year-olds and some 3-year-olds. The state general fund support in the UPK budget is 5 times the amount that the state provides in state funding to CCAP. And so just in terms of the scope of responsibility for the two programs, that seems really disconnected. So this letter outlines the impact of not having childcare in our community, and asks the JBC to seriously consider shifting significant resources from the pre-kindergarten budget to the Child Care Assistance Program budget. I did not include an amount because the JBC is making a lot of difficult decisions across all of the state budgets. But what I do know is that the 146 million that is going into the UPK budget, those are not the Prop EE funds. The Prop EE funds are separate. The 146 million is just state general fund. And so the JBC has already been asking questions in the briefings and hearings about why UPK has agreed to serve more than what the voters passed. Why is there such a significant budget? And the hearing for that department is this coming Monday. So if you all would like to send a letter, this week is really the most opportune time. I've had multiple conversations with Senator Kirkmeyer. Was actually just in a meeting with her this morning, and then joined CCI in a meeting with Rep. Sirota last Friday. They certainly understand the challenges. And I think are just trying to figure out how to make all of the difficult decisions that they have before them, but really do want to try to figure out how to infuse the CCAP budget while also looking at significant cuts in other areas. So I think I'll stop there and see what questions you all have.
Thank you, Heather. Colleagues, yes, Commissioner Stevens.
Yeah, so I was wondering, are other counties doing that same ask? Are we hearing from, CCAT and CCI counties that they are, especially the ones that are frozen?
Yes, so at our conference that was parallel to your conference last week, we had a specific CCAP session. So there is the interest to have a collective approach. Many are writing letters very similar to this. Some are writing letters to the governor's office and the State Department. The budget has already been submitted, though. So I think their letters are going to ask for a stronger commitment around brainstorming potential solutions that would help all of us collectively. What I would say with this letter, though, that I did not include on there and would revise is that it is a CC to the State Department and the governor's team so that they are aware when it is sent. I know of 6 different counties right now that are writing letters.
All the same asking for the money to be potentially be reallocated.
I know of 4 of the 6 are, yes.
Okay. It seemed, when the governor came to our CCI conference, and he seemed, somewhat unaware of the magnitude, I would say, or at least said he was somewhat aware of the magnitude. So I think the CC to the governor's office would be valuable. And also because we're, while his budget has been formulated, he has an active stake in what the budget outcome looks like, and so I think that would be good. So, but I would support sending the letter.
Well, I was at CCI, and we were having a lot of offline conversations with other counties and other commissioners and hearing kind of the similar concerns. And I know a lot of them were talking about sending some letters or at least having some kind of outreach. So certainly this is concerning. It's really going to be lots of conversations like this going forward, but certainly I think this is something to address and make sure everyone is aware of the consequences of that budget and some of this funding. So I would support sending this letter. Thank you.
Thank you, Commissioners. I too would support the letter. Wondering, a couple of quick questions. What is your hope for turnaround? I guess we would need to review this. You've suggested including the CCs, and it's one to the governor's office, and what's the other one, to CDEC? To Dr. Roy?
Correct, yes, to Dr. Roy.
So what is your hope for turnaround to get this back from us with signatures?
Ideally this week. So the CDEC Joint Budget Committee hearing is first thing Monday morning, the 16th. So if we could send it to the JBC this week, that would be ideal.
Can you make the changes that include the CC on here and send that to us for review?
Yes, I can do that this morning.
And then my only other question is, has there been any consideration, if the ask is to move some of the general fund dollars that are appropriated for the UPK, what are the implications if some of those monies are moved over to CCAP?
So there certainly is an implication to UPK. There are many more children receiving more than the 10 hours that was identified in the ballot language. So when the measure was approved by the voters, it was for 10 hours a week of UPK service to all 4-year-olds and some 3-year-olds if they met special qualifying factors. The department has actually decided that all 4-year-olds should get 15 hours. So the JBC is really asking a lot of questions about how did you decide and what decision-making authority did you have to decide 15 hours for everyone? And then there are some kids who receive 30 hours based on additional qualifying factors. So there will be an implication that likely there won't be enough funding to continue the UPK levels at where they're at. But the CCAP program is supplementing UPK because even with 30 hours, if a family is getting 30 hours for their 4-year-old, that's still not full day. And so CCAP is still having to come in with at least part-time service to overlay on top of that. But for us, we have almost 500 kids on the list who have said, we need CCAP, and we're not getting it because you have a freeze. Those are 500 children who aren't able to be served potentially until they turn 4. And for parents to have to wait and make those really difficult decisions until their child is 4 and they can try to cobble together something in addition to UPK, I think a letter sends the message that we need to look at the priorities at least equally. I would say CCAP should be a bigger priority when we think about the 0 to 13. But it will have implications if there is a significant reduction in the total UPK budget. The other piece I would say that is really crucial, and I think Governor Polis spoke to this a little bit in his remarks, the State Department keeps saying that the feds are doing this to us. They came up with these new rules and they don't have any new money. That is not the case. The piece that we have already had to implement on October 1st, which is completely change how we calculate and pay provider rates, that's a compliance finding from 4 years ago. That's already existing requirements that they didn't satisfy and for some reason didn't use COVID money to satisfy, and they're just now implementing it. So there are multiple pieces coming together, but it's not all new federal requirements.
Thank you very much, Heather.
So I will revise it and send it to you today.
Yeah, you.
Heather-
Anything you would like to add, please?
I'll just say, Heather, thank you for getting ahead of this. I know you've been following this, and your reputation at the Capitol is that you're an expert in this area, so thank you. It's a treat to have you on our team. If you could update this letter, get it to me, I can get it to the commissioners to sign individually, and we'll get it back to you as quickly as possible so that your timing needs are met.
Thank you.
Any changes you all would like to the letter besides the CCs that she talked about? Anything, any other edits? Because we're going to go with this content, right?
Mm-hmm.
It's pretty clear and straightforward. Thank you, Heather.
Yeah, I have
Thank
no
you.
changes. I
Okay,
have no
I will get
changes.
it to you today.
Great. Thanks, Heather.
Okay.
Let's,
So I will commit to maybe weekly updates to all of you individually, just on the JBC meetings as they're moving forward and what's happening. I can take that offline and get you that information.
and perhaps too, you might give some additional thought to whether there are roles for us more directly to advocate with JBC members or whatever you think might be appropriate. Unless you all have it covered as far as letters and CCI and CCAT and all the rest.
I have to just say publicly, Senator Kirkmeyer has been fantastic. We've been having hour-long meetings with her almost weekly, every Monday morning, going through each of the hearings and the briefing, or the briefings and the hearings as they're coming up, really digging in detail. I believe she is going to join for your legislative breakfast. Is that next week? But she'll be virtually. But she has really been convening the JBC members collectively, and then we're pulling in the county representatives. So it's been really helpful, and we're organizing this year in a way that I don't think we have in the past.
I would suggest that it would be helpful. I could give her a call and just say thank you for your advocacy
I think she would appreciate that.
coming from me. Thank
Okay.
you.
But
Please
we'll
continue.
get updates to you as those meetings happen.
Moving right along there, Heather.
So we're going to shift gears. We wanted to, we are at the point where our 4-year strategic plan is ending at the end of this calendar year. And then we are kicking off a new plan with some carryover priorities, new priorities. So we wanted to present the success that we've had in the 2020 to 2024 strategic plan, as well as let you know what we'll be focusing on for the next 4 years. So I'm going to turn it over to Jill. And then the second presentation, we've talked with you a little bit about some research and work that CSU has been doing on the needs of older adults and their family members. It is very tied to the strategic plan. A lot of that work will move forward as part of the strategic plan, but we wanted to give you a more in-depth presentation on that. So we'll have Katie and Aaron come up and dig into that in more detail before we wrap up.
Before we move on, will you text me the senator's cell number if you think that's appropriate? I thought I might have it, but I don't.
I'll send it to you.
Thank you.
Okay, thank you.
All right. So as Heather mentioned, we are entering the final weeks of 2024, which is wild to think about. And 2020 marked our first our first strategic plan. So 2020 to 2024 was our very first strategic plan. And in the beginning of 2025, we will be kicking off our second. So before we talk about the second strategic plan, we really wanted to celebrate the successes of the first, to the 2020 to 2024 strategic plan, and really recognize the amount of staff time that was invested into this plan, and the outcomes that we had from the plan itself. So there were 5 focus areas, so 5 strategic planning committees in the 2020 to 2024 strategic plan. So we had roughly 23% of human services, so about 103 or 108 employees that participated in these 5 different strategic plans throughout the 4 years that they were offered. And I would say I counted up hours across these 4. And if we look at individual hours, we're looking at about 1,150. If I multiply that out by the number of people that participated, we're about 3,100 hours that collectively we worked on this strategic plan to move these 5 committees forward. So just a massive amount of time and effort spent on these 5 areas. So we'll go a little bit more into depth in each one. So the first is the facilities remodel and hybrid work strategic plan focus area. So this encompasses our 3 locations, so 1501 Blue Spruce, 2555 Midpoint, and 200 Peridot in Loveland. We remodeled all 3 of those locations with a focus towards a refreshed look and feel for all the buildings, increased access to our customers. So we actually added a lobby at our 2555 Midpoint location. And we really focused on staff and what they feel and what they're presented with when they come in. So Loveland is a pretty new building, so there were sit-stand desks and a lot of other things that really worked for hybrid work. And so we built those same pieces into the other buildings. So all of our buildings now have sit-stand desks, shared workspaces, the ability to kind of come in and just plug and play so that you can come right to work, plug in, and get to work. We have Zoom rooms and different rooms filled with technology so that we can connect with people at different locations as well. So we really focused on consistent standards for staff. We really committed to furthering team connection and collaboration between teams and divisions as well. So we did promise that staff would be with their supervisors as high up as we could go. So we really focused on where people were located at each of the buildings so that collaboration and that team building could happen. I'll also mention that we focused a lot on safety and security of our staff and inclusion. So the lobby at 1501 Blue Spruce looks much different now than it did originally. So there's like individual workstations there with glass, so staff feel protected and safe kind of behind walls when clients come in and maybe get heated or elevated. So this team the work was completed in October of 2023. It was a celebratory day when we were able to move into the last building. So this was a great example of a strategic plan focus area that moved forward quickly. Okay. Do you have any questions about that one?
Do you all have any questions or comments? Yeah.
I just have one question. So, I understand the safety and security, so how do you maintain sort of the, the feel of, you're welcome here and still be behind glass? Because I do understand that we need to, like, message both kind of ends of that, and so what is that?
Yeah, I think that's been a real shift in our philosophy at our lobbies. We've rebranded them as welcome centers. We've trained our staff. It's less transactional. It's more interaction. They are behind glass, but it's much wider. It's much more open space, and our staff working in there have more time to work with and address the issues and challenges that people have coming in. So we're getting a lot of feedback that it does feel more interactive, more welcoming. We're also comment cards and things like that so that people can give feedback as to how we're doing.
Thank you.
And just to build on that, a follow-up question and a quick comment, and that is, what kind of training or orientation is being provided to the security personnel? I ask that because I recall visiting the Human Services building in Pueblo, and they had a couple of security folks, and they seemed to be very knowledgeable about referring people to this window, to that window. So that's my question, Gordon. If we're training or orienting the security folks, so they might serve as a bit of a bridge where it's appropriate. And then my comment is that regarding cubicles and all the rest, I must say I enjoyed my hour or so visiting some of the cubicles a few weeks ago, learning about big screens and moving from this screen to that screen regarding trying to manage CBMS, the Colorado Benefit Management System. That was quite an experience. Thank you for that. Yes, Gordon, question.
Yeah, I can't speak to this specific training for security. I know that we've had a lot of conversations with Tim Fox, the security manager, about it being the right fit and understanding what our needs are. I think what we have seen with the security on site, which has been new within this period, this time period, is that there's more interaction, more collaboration between those the security. Our staff is trained on de-escalation. A lot of the Bridges Out of Poverty work that we do, Science of Hope, has helped as well. So yeah.
The referral piece, though, really happens on the Welcome Center team. We try to have the security officer just able to manage what's happening. They also walk the entire building, so they're not just in the lobby. But the team has gone through a lot of training around resource referrals, who in our community provides what, so that I think that is more of the interaction when they are working with the human services staff member. If we don't provide something that you need, we can help get you to the right place.
No, absolutely. And I think making sure that the folks who are doing the security affect is really important. So hopefully they're people who understand the complexities of what y'all are dealing with in that space. Thank you.
Yeah, I'll also add that the security guards have very close relationships with each manager at each of the locations. So they're constantly talking. So a lot of times the security guard will know sooner than Tim lets him know of things that are happening inside of Human Services. So there is that good connecting point there too. Yeah. So next up is Community Outreach and Access, and Sarah Roten and Deb DeLuca led this committee, and they're not able to be here today, so we're going to have Vanessa Fuel do this update.
I'll stand in for those folks, but they really did an excellent job leading this team of staff to really think through how we can offer services differently in our community. They hosted a variety of community conversations across the county to really try to understand what is it that our community members may need from us, and not just folks who we currently serve, but who might we not be currently serving, and what might they need if we are out in another location, or if we are out in an outreach capacity, and what type of access do they need to the Department of Human Services. This group and the work that they did informed the federal SNAP grant that we received for a mobile unit. So we are beginning the process now of procurement for a vehicle, all those kinds of things, putting together that team But it was crucial that we had Deb DeLuca as a member, as the program manager from the Supported Families Stronger Communities program, to really inform the work of what this looks like as sort of an expansion of that community-based, client-driven work. So what they did is submitted to the executive leadership team recommendations for both co-location, meaning we have a site at a partner organization, we have an office there, we have a dedicated staff member, and then also what it might look like to have kind of drop-in services. So they created a menu of options for us to then be able to take forward as we start to really get into the specifics of those relationships. So that it's really going to be based on the needs of each individual community and which partner we might be working with. But we have kind of a nice menu of options right now to say, if this is what we can offer, what might you need or want? So that's sort of moving into the next quarter, next 6 months, we're really going to be getting into the specifics on where are we going to be, with which partner organizations, and what are the services going to look like in those places. So all of this work is informing that piece moving forward. They did an excellent job with this group.
So
Sorry, I had one more thing I wanted to mention that
please go
I
ahead.
failed to mention, that a lot of this work also is being woven into the strategic planning committee of your strategic plan that Lori oversees. She's leading that effort, and Sarah Roten is also a member of that group. So a lot of this will move into that space as well. Sorry.
No, that's fine. So when we think about co-location, I think we sometimes think about nonprofits. Do we think about large employers too? Because I know some have like a navigator kind of program, but for example, at CSU, we created a navigator program because there were a lot of people at CSU who worked in dining services and housing, for example, that needed benefits. Do you work with large employers like the hospitals and the school district for
Yeah, that's a really excellent question. Because it is driven by sort of the needs of what that partner wants. And what we find is some partners say, we just want you to train up our staff, and we want to be able to do that part ourselves. And other times they say, we would like someone on site to do a specific task or, specific work. But it's really anyone, right? It's not just a nonprofit partner. We've talked about partnering with Salute in Estes Park. There's a lot of different ways that could look. And right now, we do have a satellite office in the school district building in Estes Park, but that's one staff member, and really it's just for public benefits. Whereas this work helped to inform what would it look like if it's the entire department. So if you need access to your child protection worker, and we can help navigate that. If you have aging and adult needs, we can help get you to the right place. So taking it outside of any one of our silos and really opening and expanding that access department-wide.
Thank you.
And Vanessa, offline, maybe tomorrow when we see you in the afternoon for the event tomorrow, I wanted to give you a bit of an update regarding Livermore and Red Feather Lakes that might intersect with your outreach and co-location efforts, so I don't want to take the time here.
Great. I will look forward to that.
Pardon?
I will look forward to that.
Oh, okay.
All right, next up is equity, diversity, and inclusion and belonging. And so Vanessa Fuel and Thad Paul actually co-led this together, and Thad's going to provide this update.
Yeah, and Vanessa's going to back me up because she's the expert. But yeah, Vanessa and I were the co-chairs of our EDIB, Equity, Diversity, Inclusion, and Belonging. So we actually added the belonging about 6 months after we started the process. But we'll cover real quickly. Again, Thad Paul, Division Manager for Child, Youth, and Family. So this was one of the strategic plans. We started this work by leveraging a partnership with I have to look at it, so I don't use an acronym. American Public Human Services Association. So we did an organizational assessment and actually spent a couple days with this committee as well as the Community Outreach Committee and other strategic committees to kind of inform everything that we did in this last strategic plan from an EDIB lens. So that both helped us highlight strengths, weaknesses, opportunities, and kind of help us inform our work plan as we move forward. We started and we spent a lot of time, as you can imagine, wordsmithing a vision statement. So I'd like to read that if that pleases the group. We are a welcoming community where you feel safe and thrive. We have a supportive culture that values who you are through inclusion and belonging. We seek varied perspectives and experiences through active listening to challenge all forms of inequity. We provide ongoing support, education, and resources to address inequity and maintain inclusivity. So we built that over time, and that is really, it's kind of a staff statement, but as you can imagine, how we treat staff is a parallel process to how we treat the families and the individuals that we serve. So it sets the culture, if you will. We, as a group, identified opportunities on how we look at policies and procedures. There are some policies and procedures that are just very technical, like rules coming from the state, you got to do X, Y, and Z. Not a whole lot of room there, but we have a process in place for more broadly defined cultural policies and procedures that are informed from an EDIB lens that ensures that the lived experience and the experience of those that are more marginalized in our system have an opportunity to inform what we put on a piece of paper on what they're supposed to follow. We expanded our Disparities Action Committee. It was a committee that was kind of operating in pockets, and really it raises the culture and experiences of many groups, both working in our agency but also in our community, and kind of elevates both their challenges that those groups may have faced over time, but also the amazing richness of culture that is out there. We partnered with ACE Division, so ACE did a whole lot of our work for us, let's be honest. They helped us to deliver a pronoun training in 2024, and they also helped us in creating and publishing a language access plan, and then also we've greatly, through Jill's leadership, expanded our translation services available to the families we serve. So we are doing much better, I would say, in who we're hiring. We partner with HR to get a better sense on the population that we're bringing in, and we have at least my perspective, and the data would say so, much more diverse workforce that we have. So there's more translation that happens through the work that our staff already provide, but it's not enough. And so we have a pretty robust translation services that help us ensure that all languages are available when we're working with our families and individuals. Jill highlighted the facility shift. She left this piece in here for me, I'm sure. So in the facility shift in our two buildings that are solely DHS buildings, we also have gender neutral bathrooms. So it again provides an evidence to our community that we value you, we want you to feel safe and have a safe place to do your business, if you will. We supported EDI legislation in child welfare. So last year, Senate Bill 24-200 was really about, and it got shrunk down from where we wanted it to be because it was one of those late bills that said, don't bring any bills with any fiscal notes attached to them, so it had to get shrunk down at the end. But we actually had one of our EDIB committee members testify at the state legislature to that piece of legislation, so that was pretty exciting. We've created a framework for our DHS Customer Voice Council, and you'll see in our future strategic plan, this is one of the committees that kind of is going to continue in some form. But we've developed a framework, and we're still calling it a consumer council because we will let the consumers name it once we get to that place. But it really is to help find a way to highlight those that we serve and the marginalized populations and the lived experience in our community to help inform our practices and how we better engage with our community. So we've got a framework set for that, and that will be part of what we step into over this next strategic plan and with this group. And then lastly, we are targeting and belonging training with APHSA again in 2025. If you remember, I think you all went actually to the poverty simulation. So this group really started way back in the when we did Bridges Out of Poverty, all that work that happened across, and then we also helped to support the delivery, and really, let's be honest, Kayleen helped to support a lot of the delivery of the of the poverty simulation. Almost 400 people participated in that process, which was pretty amazing. And really impactful in lots of pockets in our agency. So that's it for this committee. And Vanessa, I'll kick it to you to fill in if there's other stuff.
I just have a quick comment, if I might. Thad, I'm going to embarrass you. Just want to congratulate you very much on winning your award from the Early Childhood Council of Larimer County, the Appreciation Awards last week, as you were awarded the Early Childhood Systems Builder Award. Well-deserved recognition, and just really proud to be there to see you and celebrate with you, and well-deserved. And I just want to say congratulations. And thank you to the Early Childhood Council for recognizing you.
Agreed. Thank you. Appreciate that. You know I love public attention, so I didn't need it. Thank you. Thank you. Questions?
Any other questions?
That's it on that slide. And Vanessa, did I miss anything that you? Okay.
All of these things are great. I'm just mindful of the time. Hopefully we can strike a balance, because I think we probably could have spent the whole morning discussing childcare funding.
Yeah, I think we're looking pretty good. We're heavy on the recap because we really wanted to focus on the staff time that was spent. So the next one is internal safety and external emergency, and myself and Gordon led this committee, so Gordon will provide this update.
So this was really focused on both internal and external emergencies. So as we talked about with the building remodels and the hybrid work, a lot of that was focused on with an eye towards safety for staff. We looked at fob access doors, really being intentional about where they were. Welcome center security, as we mentioned, that's part of it. Also shifting duress buttons so that they are actually being connected with first responders, so that we have law enforcement that's responding, as opposed to it sending a message to somebody in the back of the building, which is an improvement. We updated and relaunched the Larimer Prepared for all 3 locations. So we have put that all together, which was pretty complex when you talk about hybrid work schedules, who's in the building, which days. So we have monitors and marshals, and as a result of that, we've done 2 drills now. The first was an evacuation drill. 467 people, staff and visitors, were included in that back in April. And then in October, we did lockdown drills. 346 people, staff and visitors, were included in those drills. What was really impressive about the lockdown drills, we had one that was on Halloween morning with all of CYF in the building, and within moments, everybody was locked down, quiet, did exactly what we wanted them to do. So we're also educating everyone on standard response protocols, making sure they understand what they need to do in the event of an emergency. So that's continuing work. On the external side, we have become the leader in coordinating mass care response for the community. So American Red Cross has had limited or diminished ability to lead that effort. So we have stepped in at the request of the state and with Office of Emergency Management to be the coordinators for that response. We've had to put in a Department Operations Center in order to have staff understand what it takes to respond to those emergencies, support people who have been displaced due to emergencies. And we've been tested on a couple of occasions with Alexander Mountain Fire and also the Pearl Fire that impacted us, and we stepped up to be able to support those in need in our community in the event of an emergency. Let's see, did I forget anything? A lot of work has gone into developing the plans for all of that, so and the training for all the staff that's involved in that work.
I'll also say that a lot of the work that is in this committee has been operationalized within the department. So this committee will disband per se, and then the work will live on with a few key staff members in HS. All right. Last but not least is our peer and employee resources, led by Lori Metz.
Good morning, Lori Metz, Aging and Adult Services Division Manager. I will go through these not in huge depth because you all heard this update pretty deeply at the end of October at the HEH work session that Vanessa and I presented at. So just share a little bit more. One of the biggest things that we did was completed the staff survey about the ambassador program, which then led to feedback and kind of a shift in our approach for that program. So the two biggest pieces that I would say, or three rather, is the expansion of the P with a Peer series for group topics. Within the evaluation survey, staff were very vocal about liking that group session and that one-to-one piece just not being something that was being utilized. So we took that to heart. So popcorn with a peer, pie with a peer, potato chips with a peer, pickle with a peer. I don't know how many more they're going to get to come up with, but it's been great to watch. And they are using some of those tenets from the Science of Hope that we shared with you all in October to lead those sessions and inform what they're meeting with the groups about. They're doing actually a holiday cookie exchange this week, so that'll be really fun with that piece. The other side of it that we heard from that staff survey and just from informal conversations with our staff during the managerial series is that our managers need more support, that they need specific sessions for themselves. So in the expansion of the resilience groups, which has been very successful in the CYF, the Children, Youth, and Family Division, for over 10 years, that did go department-wide earlier this year with the starting of a supervisor group, which is actually ran by Katie Stieber, who's here today. It is our most well-attended group and full when it comes to capacity. So that is definitely in the works for the upcoming strategic plan, which you'll see, to continue to increase those supervisor resources because they are really using them, which is really great. I mentioned the Science of Hope. We're continuing to implement those strategies across the department with active conversations with Dr. Ferris and her team, with these leaders for peer on that side of things. We have had 2 opportunities to measure both individual hope and collective hope scores. And in that piece, we all just want to make sure that we realize that hope is a collective piece, that we can borrow one another's hope. So that's something that's going to be coming loud and clear in this upcoming strategic plan that you'll hear about here shortly. And lastly, Heather and myself have been working quite a bit with our County Human Resources Department about supporting staff, particularly those with lived experience. We have done a great job, as Thad mentioned, to recruit individuals who have that expertise to be able to provide that parallel process when we're working with clients. But we've also come to learn that we're not great at knowing how to support them. It isn't a unique group of people, so the response to their needs should also be unique. So we are actively working with Human Resources about different options in the community for contracts to help those individuals as they work through, some of maybe their own trauma as they continue to support the community and do that important work. So that's been great. So any questions?
Thank you, Lori. Questions, colleagues, Commissioner?
Yeah, I don't have any questions. I just really appreciate this work. And I'm glad that you're, really leaning into doing this work because the work that you do is so hard. And, when I think about the safety or having to take on some of the work on emergency situations, you're always asked to do more with the same amount or fewer resources. And so, one thing that was eye-opening when I was in the part of the poverty simulation was there was a person who said, we did a debrief at the end of what that experience was like. And one of the staff members said, well, I'm a broke single mom right now, so this isn't that far away from what my world is. And so obviously really good to have people with lived experiences, and then how do we help people, and so I'm really glad that I'm not surprised, but I'm glad you are conscious of that and really trying to work with folks who are struggling, because it's hard to sometimes do hard work when you're also having a hard situation in your own personal life. So thank you.
Appreciate all of this. I think we need to take care of each other, and I'm glad to hear about the peer programs. We see this with behavioral health and with the Regional Opioid Abatement Council, where we have a lot more folks going to where folks are at and trying to make sure they know they matter, they're valued, we care about each other, and I think that's just so powerful. I was volunteering, giving back over the Thanksgiving holiday to make sure kids and families don't go hungry. And I was talking with some of those folks who showed up, and they actually said, just, quietly in my ear, just so you know, I'm one of those moms and families who could receive these benefits, but I'm foregoing this year because I know there's more need and there's only so many slots. So I have a network who's taking care of me, but I wanted to give back. And so it's interesting. I think there are a lot of folks who maybe we do not know what they're going through or their life experiences unless we're in their shoes. And so I think that's one thing about that Science of Hope and some of that poverty simulation that you've been sharing is we get to take a moment and remind ourselves that, that small act of kindness, because you just never know what someone's going through every day. So I just want to appreciate my appreciation and gratitude that you guys are doing this for each other, but also this will ripple throughout their services and how we deal and take care of our residents and our communities. And I think this is going to be a foundational and legacy kind of movement that I think will be around and what we're going to need for this month and for the years to come. So I just want to tell you it's meaningful for me, and I just appreciate the collaboration, the partnership, and the leadership you're all showing. So thanks.
And I will mention that in my recent column, Restoring Public Trust, Part 2, I did reference the University of Oklahoma, the Science of Hope, some of those resources for folks. So, thank you.
All right, great. Well, that recaps our 2020 to 2024 strategic plan, and I'll say the amount of time and effort that went in was immense. So that was amazing to watch. So next up, we're going to just high-level overview of our 2025-2028 strategic plan. So there were 5 high-level steps that we went through. We started this work in May of this year. And the first was just to review a high-level overview and approval of the process itself. So we reviewed our vision, mission, values, and staff statement. And after ensuring that those still aligned with how we felt moving forward, we moved on to the next step, which was data gathering. We looked at a lot of different avenues of data, which I'll get into in a second. And then we went to engagement, which we really focused on engaging with staff and engaging with the community throughout this process to make sure that we knew the wants and the needs of those 2 areas so that we could build that into the plan. Then we developed it, and now we're presenting it. So we're in our final stage now. So data gathering, we looked at this as basically two buckets of data. So client information and then client information and satisfaction data, and then staff information. So under client information, the department activity report, which is something that we bring to you guys quarterly, was a big piece that we shared with all staff and the leadership group that came together. That includes about 19 views, and it has comparative data about where we are currently in the work that we do in human services. We did client demographic data, so we mapped data from our aging and adult services, our benefits and community support, and then our child welfare clients to see what does our population look like. We found that about 56% are female, 87% are white, and 24% are Hispanic, which is an increase from 2020 from 22.6%. So that went up a little bit. We also reviewed client or complaint information, so just data and trends. We didn't look at the context of these complaints, we just did counts for these, and that includes informal, formal, child protection ombudsman inquiries, SNAP, and then civil rights complaints. And then finally, in this same category, we reviewed our Google review data, which, as you can imagine, we have Google locations for each of our facilities, and so people are either very happy with us or very upset with us. So we just shared where we are sitting with those reviews and always working to do a great job. And I will say that the Welcome Center has received many great complaints over the past 9 months since the shift towards really interacting with clients as they come in. So, and then the last bucket was human service staff information. So we dug into HOPE scores. What are the HOPE scores across the department inside of each of our divisions. We looked at the countywide employee survey. What have our scores done with that? Have they gone up? Have they gone down? We looked at staff engagement in the committees, which I mentioned earlier was sitting at about 23%. And then we do an employee communication and training survey each year too. So we identified areas in which we were doing well and areas for improvement. And then we looked at employee demographics, and this comes from the county equal opportunity data that they publish. And so we did find that we had a decrease in female staff from 2018. So from 2018 to 2023, female staff decreased by 2%. From 2019 to 2022, Hispanic and Latino staff increased from 14% to 22%. So that talks a little bit about what Thad was saying, is that we did actually see that in the data. And so we don't actually have the 2023 numbers yet. So as soon as we do, we'll add that to the dashboard as well. So we looked at all of this information as a whole, and we also included focus group information. So we spent about 90 minutes with each of the groups that you see listed here. So we released a stakeholder survey to community partners, and we did find that in that survey we're listed at a 4.1 out of 5% rating. So that's doing pretty well. We're getting 4.1 out of 5 stars when it comes to working with our partners. And then we got about a 30% response rate from that, so we want to improve that for next time. And then we met with the EDI advisory board that's countywide and just talked through what they know about human services, what they would like to know, ways they want to see us partner in the future, and what questions they kind of had for us so that we could build that in as well. And then again, as I mentioned, we really wanted to focus on staff feedback, so we spent 90 minutes with each of the divisions in human services. So aging and adult, administration, communication and excellence, benefits and community support, child welfare, and operations. I realize they're all acronyms, so that's why I stated them all out here. And then we did a separate group with just our deputy division managers. So we wanted to make sure that we were listening to what our managers had to say as well. And we thought that they might give us a good perspective on the department as a whole. So we took all of that information and met as a strategic leadership team, and kind of encompassed some areas to focus on for the next strategic plan, so the 2025 to 2028 strategic plan. So this is a visual representation of that plan. I felt like it was very easy to kind of see what we were doing moving forward. It's going to look a little differently this year. So you'll still see there are focus area buckets that are showing on the screen. EDIB is our equity, diversity, inclusivity, and belonging. That's the one committee that will move forward. Management is a topic, internal communication, collaboration, and then we're going to have a division goal bucket that each of the divisions will focus on their own strategic planning goals and work on business improvements or different processes that they need to get done in the next 4 or 5 years. So you also see that's a little different, and I'm kind of stalling to see if Heather comes back, is the Hope Council. So we have decided that we're going to create a Hope Council for our staff to participate in. And I'll just go ahead and do it, and then she can add to it if she comes in midway. Okay, good. So this one will be facilitated by Heather O'Hare and Lori Metz, and this will be an employee-led committee that really advises strategic planning committees. Oh, you're back. Great. Do you want to take this? Are you ready? Do you want to do Hope Council?
My apologies, bouncing between meetings. So the Hope Council is intended to be almost like an internal advisory board. I think we have a lot of opportunity to shift decision-making down in our department, and working with this group to figure out how we do that, but also be really intentional at providing this as an opportunity for professional development as well. We see a lot of staff who are interested in becoming a supervisor or interested in becoming a deputy division manager, that haven't had a lot of experience in decision-making to this level around policy procedure. And And then also be able to provide capacity to making sure that the ongoing strategic planning committees stay aligned, that there's not duplication, and that we're also finding ways to connect the dots between the committees. So there will be a little bit of oversight that this group will do over the strategic planning committees as well.
I'll say that is perfect timing that you walked in. Like, I didn't even see you, and I was like, yes. All right. The next area that we'll focus on is management development and consistency. So this will be actually facilitated by all of us that are sitting at this table right now. So we call ourselves the executive leadership team. So we're going to further focus on development of managerial skills and improve consistency in management practices across the division. So we really want that holistic approach and one that is consistent across all the divisions. The first thing that we're going to tackle is revamping our employee evaluations. So right now there are a lot of questions to cover, and none of them kind of relate back to our values, our mission, our vision, our staff statement. So we're going to take an intentional shift to focus on those values and ask questions that revolve around that. And we're going to have all of the managers participate in that as well. And then some other areas that we are probably going to cover would be that management consistency. So looking at employee accountability and what that process is, how we can improve, how we can kind of share safely information that happens so that we can kind of share knowledge between each other about what's happened with each of us or in different settings so that people are kind of aware of how a process can move forward and how it looks differently. We'll be doing some intentional information sharing. So we found in those focus groups, there are a lot of forms and information documents that we have across all the divisions that we don't share. So we're going to work really hard to share some of those things together and then really focus on communication and change management standards and methods. So what information are we sharing? How are we sharing it? When are we sharing it? We'll look at all of those things together. The next focus area will be continuing the EDIB, or Equity, Diversity, and Inclusion and Belonging work. So Vanessa and Thad will lead this. And one of their big pushes forward will be the client council structure that Thad mentioned earlier. So determining what that long-term plan is, creating the application, and getting that, that committee seated. Additionally, we'll be looking at an accessibility roadmap for our internal systems. So we're going to be, the legislation that came through a couple years ago that IT is focused on, we're going to assist them in creating a roadmap for our internal systems in human services so that we can make sure our employees are able to gain access to any systems that they use. The third area will be led by myself, which will be internal communications. So this is really enhancing and standardizing internal communication. So not necessarily all of us just doing the work, but maybe creating a bigger committee where everyone kind of comes together and we can move best practices for communication forward. We'll deepen the use of the block, which is our intranet, and where we share the majority of our information amongst staff. Develop processes for and communication methods for state rule changes. So each division, as you can imagine, gets memos from the state on a regular basis. How do we digest that information and then share that out to staff? That will be something that we'll be looking at best practices for as well. Information sharing about community partners and resources for clients. Again, how can we share the information that we already have? And then also developing consistent change management standards and policy and tool communication. For policy and tool communication moving forward. So really paying attention to how the information that we share impacts our staff and how we can make it better. And then final big focus area group is increased collaboration. This will be facilitated by Gordon and a DDM. And so this really is going to focus on strengthening collaboration and communication across human services. So the first thing that we'll tackle is developing a client journey map. So how do clients come to our doors at any point? So whether they come in through Thad's team in child welfare, Lori's team in aging and adult, or through a welcome center for operations, or even an application through benefits and community support, how do they come in? What does that journey look like? And where are those intersection pieces so that we can take a look to see where are the pain points, and then how can we get more efficient and address those pain points moving forward so that the client really has that no wrong door approach and really can access everything that they need all at the same time. And we'll definitely be promoting sharing knowledge and best practices across divisions in this as well. So now we'll quickly highlight division-specific goals so that you guys have a view on what those will look like. And so I'll toss it over to, do you have questions before I go forward?
Yes, I do.
Okay.
Go back to the last one.
That one?
No, actually, the increased collaboration, the client journey,
This one.
this one, yes. I'm curious if that will also include understanding the participant's journey outside of our Department of Human Services. In other words, have they interacted with other community-based groups? Will it,
Yeah, I think there might be a section of this where once we understand our internal process, we'll do connecting points about where people are connecting in the community and maybe what resources are heavily used and which ones aren't as heavily used so that we can make sure that clients or customers are aware of those access points.
okay, thank you.
Any other? Okay. I know. We're quickly covering this.
Quickly covering. So for Aging and Adult Services, our division-specific goals, community supporting community. This is a direct result of the CSU School of Social Work research, so I'm not going to go into it too much because Katie and Aaron are going to do a much more wonderful job of doing that here shortly. And just what we heard about from those communities that we had those conversations with. Another is cultural responsiveness, kind of broadening what that means, particularly around the aging space, not just around ethnicity or race, but also LGBTQ, and also when it comes to communities too. We are, everyone is kind of guilty of being Fort Collins Loveland centric. So just what does that look like in different communities and the cultures that they have and how we can respond to their needs in that way. And then increasing our use of internal communication tools. We also have several access points coming into our division. So what can we do within kind of the rules of the road for confidentiality to assist individuals to not have to tell their story multiple times or their caregiver to have to tell their story multiple times. So I think that we have a lot to learn in the aging space with that.
Before you move on to the next bullet, I'm curious regarding things like cultural responsiveness, community supporting community. Will you also be emphasizing how can we be more intentional about promoting intergenerational interactions like kids and older adults or teens?
That's not something that we had, but I would love to include that. And using those resources that are out there to facilitate those conversations.
So you will be looking at that?
Sure.
And of course, Commissioner Sheddock McNally has a lot of experience with that.
Yes, she does.
Thank you.
I'll cover East quickly. Administration, Communication, and Excellence is a fairly new division. So we're going to develop and maintain key performance indicators and create a dashboard so that everyone can see the work that we're doing. And with that, we're going to develop standard operating procedures to go along with that. We'll communicate and project manage the 2025 to 2028 strategic plan. So I think one of the last slides is just a brief overview of that. And then we're going to increase and enhance data around client satisfaction and customer service. Toss over to Vanessa.
Okay, for benefits and community support, we are going to deepen our investment in staff and expand our opportunities for professional development, tagging on to the department-wide strategic plan, focusing on cascading communication, and continuing our efforts around employee engagement and retention with our division-level Hope Council.
Bad Paul, Child, Youth, and Family Division Manager for Child, Youth, and Family, will be focusing on staff engagement, which is a broadening communication plan, but also the accountability. So I think all of our smaller committee all of the strategic planning committees and all the different divisions directly tied to the structure of the whole department, so it's all very well aligned. So staff engagement, workforce enhancement, which includes staff, boots on the ground staff, supervisor staff, as well as administration, and how do we help support them being their best and giving them the tools to do so. And then division enhancement kind of fits within the category of all the things that kind of flood downhill from our state legislator and all the rules and regs, and how do we implement those to do our very best practice while finding efficiencies.
And for operations, first we're looking at internal communications, how policy changes, rule changes, all those things impact our division and anything we do internally within our division, how that impacts the other support of the other divisions. So we'll be working on that. And how to best communicate that to our staff. And then customer service. So really with all of most of the work that we do, impacting how we serve the other divisions, really coming up with a customer service model, setting expectations, making sure that people understand, the people we serve, both customers and other divisions, understand what expectations, what our needs are from them, and what they need from us, and how that's communicated back and forth.
Awesome. So the last focus area really will be the ACE team and focusing on committee organization. So we're going to really standardize and create consistency around the process for these teams. We're going to have each team create a charter and a work plan. All will be focused on HOPE and EDIB, so they'll have some kind of characteristic that ties into both of those. And then the ACE team will consistently attend and provide guidance for the committees, and while providing visibility to leadership and the HOPE Council and organization around the process, so that there's a regular feedback loop throughout. And then the last piece is just next steps. So we're presenting this to the rest of Human Services. We presented to the managers the week before Thanksgiving. And so this week we will present this to the rest of the Human Services staff. And then on Monday, we will launch the applications for each of the committees. So we do an application process so that those people that are interested can apply to, we have them rank their top 3 choices. And then from there, we develop what those teams look like. We're hoping to have the committees selected by January 31st and then have work kickoff on February 1st. We got through that quickly.
Thank you, Jill.
Yeah.
Colleagues, before we move to the next item, do you have any questions, comments, feedback? Yes, Lorinda, let's start with you.
I do. So when I look at the old strategic plan and the accomplishments, it's really incredible how much you've been able to change the culture using these elements and these things, these committees. It's interesting to me how you wove across all the different focus areas, facilities, staff, services, clients, everything had sort of an equal measure as you went forward. And so that's really impressive. And I like that it carries forward into the new strategic plan. The one I don't see in the new strategic plan is anything around finances or transparency around finances to staff. We know we started this meeting with this discussion around CCAP, and finances seem to be a mystery to our staff in general across the county. It's not unique to Human Services. I was just talking to the sheriff about something very similar. How do we tell that story as part of the key KPIs? Where are we against our finances? What are we doing to combine positions and to make the most of the money we get? I think employees are interested in that too. And I know that must be woven in because we talk about it a lot, but I don't see it in the plan.
It's a great point. I do think we can elevate it even more and have it more structured. I will say it is a constant theme of our town halls. So we've continued doing the town halls that we started out of COVID. We have a very similar budget service proposal process internally that we also have countywide. So every year staff contribute ideas. Sometimes they're enhancements where they think we should spend money. Sometimes they're where they think we should save money. So it is interwoven into some of our just procedures that we've put into place, but I think we can elevate it. We used to do sort of budget HS Finance 101 lunch and learns, come and learn how we're funded. We've been talking a lot about how we're funded as we've made some specific policy changes. to say to staff, if we're paying more in our sort of mileage reimbursement or other indirects, that's less than that we can pay in these other areas. So we talk about it a lot, but I do think we can structure it even more.
Thank you, Lorinda. Colleagues, do you have any questions or comments? I do have one quick comment before we move on. Commissioners?
I'll just thank you for sharing, where you're at with the new strategic plan, and I'm glad you're carrying over the signs of hope and the belonging piece, because I think those pieces are really important. I was just kind of thinking as Lorinda asked her question about, the signs of hope, how, and talking about the budget, because sometimes those two things can be very, sometimes it feels like not very hopeful when we are talking about the budget, because there are so many uncertainties and potential cuts and things like that. And so I guess, you're all thinking about that, but, what does that look like to keep that hopefulness around when things feel very uncertain, probably for both our funding and where we go from here. So I know you will figure that out. I wish you all the best. And I do feel hopeful, because I know that we all work together as a team on this work, and that we're, things like the letter you asked us to write this morning. I mean, we are trying to address how we deal with funding shortfalls, and but that will be. I'll be curious to see how you navigate that, because I think that I certainly would also want to learn how to best do that, because sometimes there is some feeling of, I guess I could be using the word uncertainty, but it is, right? New administration, less dollars in the county, less dollars at the state, uncertainty at the federal level. And so I think that it's good that we have the hope research in place, because I think we're gonna all need to learn from that in the coming years. Thank you.
Thank you, Commissioner. Anything, Commissioner Shattuck McNally?
I just want to pretty much repeat everything that Lorinda had said. It's just really amazing to me, some of the changes I've seen, and just the underlying threaded integral feelings of we can do this, kind of from all the years that we've been sitting here, and instead of focusing on what's wrong, you're looking at how we can go about this, about how we help each other to do and highlight the things that we can do, and how we can help folks. And I just I find this very poignant at this month, when it's such a month of giving and caring and trying to give back to the community. It just feels really timely and important. So I just want to commend you all for the work that you do, your commitment, but also, I've said it already before, but it's just this team, the way you all integrate and work together and support each other. It's just pretty special and outstanding. Thanks.
And yes, me too, thanks. Thank you. But I did have a comment and a heads up for Heather in case someone contacts you. And also to remind Vanessa that I hope we can have a conversation tomorrow, give you a bit of an update on some of those communities and see if it intersects with the outreach work and all of that. But my comment is referring to, I think, some things you said, Thad, and I believe Jill said as well, and that is how we have changed or adjusted some of the job descriptions, and that's probably contributed to being able to hire folks, retain folks, not being as rigid perhaps regarding educational achievement and all that. And I bring that up because on Friday at the State Board of Human Services meeting, we had a rather extended and robust conversation about the first two sections of the residential child care facilities rules regarding facilities that provide services to high acuity need children and youth, et cetera, as a result of House Bill 24-1038. In any event, I brought up that we've had some success with adjusting job descriptions because there were some requirements in those rules about educational background to serve at a QRTP, for example, a Qualified Residential Treatment Program, and I suggested that the rule writer, Logan, might want to reach out to you because we've had some success there, and that might help inform, how we move forward with these rules. Thank you.
Thank you. I can connect with Logan. So we are going to shift gears a bit and close out this morning hearing about some research. So the Aging and Adult Services team, Lori and Katie and Aaron, have connected with the CSU Social Research Center, and we utilized some of the COVID-related money that the state gave to us to do some research and to do a more robust needs assessment and really know more from our community about what do older adults need as they age in our community, and also certainly what do their family members, their support networks need as they age. So we're going to close that out this morning with Katie and Aaron giving you an overview and sharing the next steps.
Good morning, Katie Stieber, Deputy Division Manager, Aging and Adult Services and Human Services.
Good morning, Erin Alt, Program Manager for the Larimer County Office on Aging.
And to say the least, we are very excited to share this out. It's been a long and lengthy process, but very extensive, and we did a deep dive into anything and everything aging and adult in Larimer County. We are going to go ahead and go through the entire presentation and do questions at the end, only because some of it's very interrelated, and you'll see some common themes that come about that once you hear it, you may not have those questions anymore, so we'll see. We are going to start with a video actually put together by CSU as to the process. So it was very intentional that we didn't reinvent the wheel, so this is pretty self-explanatory.
In 2023, the Larimer County Office on Aging and the Social Work Research Center at Colorado State University began work on a community engagement project. As this process began, this project sought to build from, rather than duplicate past efforts, and develop community-generated next steps based on known older adult needs. We started by summarizing previous local surveying and engagement efforts. This included incorporating formal items, such as the community health assessment, and informal items, such as community conversation notes and organizational reports. Cumulatively, these sources represented input from hundreds of older adults and community members across Larimer County. Across sources, key community needs for older adults included transportation, medical and in-home services, social isolation, lack of service awareness, food insecurity, and disconnect from urban hubs. However, many of these prior efforts focused on county-level needs of older adults versus community-specific approaches. Additionally, some engagements were limited in reach, missing important community voices in the process. While a lot was known about needs, very little was known about opportunities for specific next steps. This evaluation aimed to recruit a wider representation of voices and bridge known challenges with community-generated strengths and solutions. To link information with action, we took a targeted community-specific approach to engagement. We used previous research, community input, and administrative data analysis to select 4 communities. Ultimately, we prioritized communities that had high levels of need, limited service utilization, and aligned with LCOA's strategic priorities for 2024 to 2027. The communities selected included Red Feather Lakes, Estes Park, Berthoud, and Latinx older adults and caregivers. LCOA and CSU developed individual engagement approaches for each community. Utilizing in-depth one-on-one conversations, outreach was focused on those identified as underutilizing current services. These included Spanish-speaking, rural, low-income, and homebound older adults. Participants were identified by the community as key knowledge keepers, people who serve as cornerstones of community or cultural information, social networks, or service hubs. Across all 4 communities, we engaged in over 60 hours of conversation with over 31 individuals and 19 organizations. Office on Aging staff attended many of these conversations to link community information and relationship building with next steps. Each community also engaged in an asset mapping process. Here, communities defined for themselves the people, places, and information points they felt were most important to engage in future aging-related efforts. We also built deeper understanding of community-specific context, values, and approaches as they related to aging-related challenges. Relationships built throughout this conversation process were key in creative, collaborative interpretation of the data. Community members made connections between identified needs, community-specific strategies, and related local partners or resources. These became the report's recommendations. While recommendations are community-specific, a number of high-level themes emerged across communities. These included recommendations to develop community-specific services and outreach approaches, build consistent community presence and trust, conduct outreach through existing networks, and build from existing community strengths. Currently, LCOA is in the process of working closely with the strategic planning team to prioritize specific action items and timelines. In 2023, the Larimer County Office on Aging and the Social Work Research Center at Colorado
Did
State
you like it? We're
University
going to go over it
began
again.
work on a community engagement project.
Thank you. Take two, Moana 2. It's out this weekend. You might have heard some of this in the video already, but we're going to touch on a few of the key items. What was provided to us was really amazing. It was an immense amount of information. We did work with our strategic, internal strategic team to what rose to the top, and we'll talk about those first steps as we move along through the information. There was both community-specific and kind of overarching information given to us. Some of it was similar and some of it was not. We've got both qualitative and quantitative. That quantitative is great, but that qualitative is wonderful. And then the maps are key to some of our first steps in finding those new partners and putting relationships together. So that's essentially how we put what got handed to us from CSU.
All right. This project sought to gather a broader range of perspectives and addressed recognized challenges by leveraging community-generated input, strengths, and solutions. The overarching goal is really to build upon community-specific strategies while enhancing the capacity for implementation of all of the information outlined in the data. We will elaborate more on these throughout the presentation. But as we begun the research, we identified 4 key areas of focus that really stood out across the region. As mentioned in the video and on this slide, these included Estes Park, Red Feather Lakes, Berthoud, and the Latinx communities. Our hope really is to strengthen relationships across these areas and increase our outreach efforts, and also the information sharing piece we recognize as key. One thing I want to mention is this is not a quick fix. This will be part of the larger scope that spans over the next several years. As Katie mentioned, we did seek technical assistance from our internal strategic planning, and they did a great job to organize the information. And there will be a handful of Office on Aging and AAS staff who will take the lead in each of these focus areas as we move forward. And as mentioned also, we are very thankful for this opportunity as we walk through this great work and look forward to building upon the common themes that are outlined in the data and our presentation. All right. Our initial focus in Estes Park will be to build upon existing hubs for underserved communities by connecting key stakeholders and agencies to the community networks that are already in place. We have no intention of recreating the wheel. We did learn a lot out of this data, and within this objective, there are many layers of action that will roll out over the next few years. Success in this project is really going to be about endurance and persistence over time. It's not just a race to the finish line. We want to really be working on building those partnerships. And we are starting by understanding the asset maps to target new partners, utilizing our existing advisory council members, and also Office on Aging staff to connect with Crossroads Ministries, Estes Park Health, and the library during this first round of community relationship building.
And that took us to Berthoud. We actually excitingly discovered there's more agencies and relationships and resources down there than we realized. It's not abundant, but what was really exciting as we did the talks is I actually already have chatted with the library, some staff at the library, and some other the church down there and House of Neighborly Services. Our first objective, as you will see, there's always going to be a current or first objective, and there's a multitude of other objectives per community. But again, it's that marathon. We're not going to tackle all of these. So our first objective in Berthoud is working with 2 new partner agencies.
All right, let's talk Red Feather. Again, our initial work will be on building upon the existing framework already in the community. Red Feather Lakes has proven to be filled with strong support systems, and our initial objective will include steps in identifying those key community contacts and to share information with. As you are all aware, this community has an excellent foundation in networking, and we plan to tap into that and build upon this existing base. There will be opportunities to share potential funding streams that match the needs of the community, provide letters of support, and come beside local initiatives. This will include any state or local grants geared towards the needs of this rural area, especially around their transportation needs. We do plan on, building upon and sharing information at all levels. If that's, connecting problem solvers at the local, state, and national levels, we want to make sure we are keeping everyone connected to opportunities and coming beside them in those efforts.
Our last focus group was the Latinx community. We've definitely done some progress with this community. We did utilize internal staff to help us guide through the process, connect us who to talk to, and really do a deeper dive into this community. Our first objective is going to be just enhancing our cultural responsiveness. We can't go to one staff person and say, help us with everything Latinx. So educating ourselves across the board, utilizing more internal services and resources. And again, coming back down to those relationships and going out to where folks are. We had a resource fair, for example, no Latinx, folks came to the event. So we're looking at, if they don't come to the event, how do we go to where they are?
All right. And then all of the efforts mentioned thus far are essential pieces in our overarching plan, and many of them have already been started. We understand that our efforts need to be based on both the qualitative and the quantitative data that we have available to us. We are able to tap into current usage by zip code, demographic data by area, program and service usage, and much more. This will allow us to hone in on the specific needs in the communities with that targeted outreach, not just kind of a blanket marketing technique. We also are very excited to be able to collaborate with the Benefits and Community Supports, the vehicle that they are working on procuring now. It's going to be amazing to have Office on Aging staff be able to use the vehicle in partnership with that SNAP or food assistance outreach in the community.
And back to those overarching themes, networking is key. And Erin used the term catalyst. It is going to be very important that our small team doesn't take on that whole onus of going out there and doing everything. But we discovered a multitude of agencies, for example, in Estes Park, 163 nonprofits. Were they all talking to each other? And we already discovered they are not. So we are going to be that catalyst of maybe some time up there and outreach events and introduction events. So that's that networking piece, and which ties right back into relationships. And I'm going to let you go over the last two.
All right, absolutely. And we also know that it's very important to really share who we are, who the Office on Aging is, and then the overarching human services. We want to make sure we're sharing information about, all of our services and getting folks connected And then again, we all have that common goal of really building upon those existing relationships. And then, empowering at the local level for them, and supporting them in their locally led efforts.
That's who we are. You know how to reach us. Please do after today, if we don't get your questions answered. We do thank you for your time. It's been an amazing journey so far. And questions?
Well, thank you, Katie and Aaron. Yes, Commissioner.
Thank you, Mr. Chair. So first, it's been nice to see the progression of this. I know we had this presentation from some of the students and this in the Office on Aging, and I know the council's really excited about this too. So I'm glad to see it kind of have some analysis or synopsis in here now. So this is great. I know that one student was just her energy is just, she loves this. It's amazing. So I have a few comments and a couple of questions. So bear with me, I just want to rattle through all of these if you don't mind. First, the first thing that set out to me, because I actually had some outreach and met members of the Latinx community, because that's my question. I'm yesterday, and we had some good conversations about things. And I'm wondering why we're using Latinx, because it's usually Latin A and other. And so I'm just curious, because that's not in any of the communities that I have recently been out in the community in Berthoud and Estes Park and Loveland. And I know I met with a very involved group that's doing this work, and that is not a word that they're using. They actually push back against that word, so I'm curious about that.
Absolutely, great point. We asked that over and over again. We talked to numerous people as well and got the plethora of answers of Latinx to Spanish to name the actual culture. So we're going to continue to use Latinx until we get there are just like other demographics, the people we chatted with, that was in that moment the appropriate.
Well, I'm sure you'll hear from some of them, because I'm sure they'll see this. So I'll have them reach out to you, because I know they already have had that
absolutely.
conversation with me, so they're kind of, so that's what my first thing. And I know we don't use that as a board, so I'm just trying to be consistent. So the next question I have, you talked about Estes Park and the conversations up there. I could have shared with you, they're not communicating. So that was something that is very common. I didn't hear the Estes Park Senior Center mentioned in the presentation, and that group, that large group that's in that building. Are we making sure they're staying in the loop and part of this conversation?
Yeah.
Okay, great. And I know also I would make sure the Estes Park electeds, town trustees, and some of the former mayors and things, that you kind of have them in that conversation, because they're pretty wary of anyone disrupting that, even though we see maybe some communication opportunities to improve. We want to make sure we're reassuring them that we're not trying to come in and disrupt. So just wanted to share that, because I've heard that loud and clear from them the last 2 to 3 years.
Yes, thank you so much for that, Commissioner. We have had recent conversations with the town of Estes. They've actually invited us to come to a meeting, I believe it's in March, one of their evening town hall meetings. So thank you so much for that information.
Yeah, and then and Heather knows about this, because I brought this up to her and I haven't had a chance to follow up, but I see the Berthoud conversation, and I see, again, some groups there. This is great, that we're reaching out and strengthening that, because I did get contacted and went down and have a conversation with a very large group that I have been in contact with since 2018. They have been moved 4 times. There was over 40 people in that 2 weeks ago. And I think they were part of this focus group. They had told me that. So I'm very excited to hear that. They want me to bring you all down to have another conversation with them in June and February. And I had talked to Heather. I hadn't had a chance to get in touch with all of you, because I'm finding I don't have the energy to keep doing 15-hour days anymore. So I was curious if we could do that. They certainly want to make sure that they have some opportunities to not have to be meeting. They've been moved from one where they had a kitchen and then they had another kitchen. Now they're inside a church where they have to pay for the breakfast out of the church, and that they can't always afford that. And they would like to be able to make their own coffee and have their own, bring their own birthday cakes and some of that. And so they were really looking into how they can start to formalize and have their own formal space, whether it's in this building the Berthoud had bought, but they brought out that they're very aware, and that the Berthoud or Estes Park and Wellington have their own senior centers, and they have been bounced around. And there are several former Office on Aging Advisory Council members that were in that room, so certainly they are aware of what's opportunity. So I was hoping you might all join me in that.
We can certainly do that. And, for example, House of Neighborly Services has on their plan to build their own facility. We'd love to talk to the Recreation Center a lot more. That would be a natural fit. So again, that catalyst piece of getting these mediated and some conversation.
And I think that's the conversation. I believe they had a conversation with the town of Berthoud, because that building may not be coming to fruition as quickly as.
Sure.
And so they want to make sure that they had a space and that they have access to be able to, that kitchen. So I wanted to just bring that to your attention. It's been about 2 weeks, I think, Heather, that I had that meeting. It was supposed to be a 20-minute presentation. I was there an hour. So very, very wonderful group of individuals, older adults in the town of Berthoud that are really wanting to, provide this. And I've never seen the group that large ever in my experience since 2017, 18. And so I was very excited to see them still kind of thriving and getting larger. So I think that's all I have for now. Certainly, I've been meeting and having conversations with these groups, so I know they really appreciate the networking and bringing together, maybe trying to streamline some of these conversations and bring those together. Thanks.
So just on the Berthoud piece, I've asked Kayleen to connect with your teams, because you said they have a reoccurring meeting in Berthoud, so she'll work on getting that on the calendar.
Every Thursday.
And then just for clarification, is there a word that the board uses instead of Latinx that you would prefer?
Latin
Latin-A?
Thank you.
Okay.
That's what the EDI code as well.
Okay.
Okay.
Thank you.
Thank you.
Well, thank you for the presentation, and really exciting that you're doing this work with, or have done this work with the social work and department, and have this, sort of data-driven focus. I think this is great, because I think sometimes some of our outlying communities, and certainly our Latinx community, kind of feel like we're not always paying enough attention to them, right? And that we're not aware of some of the needs that they have in these smaller communities. So I think that that's wonderful. I will say that I don't know how much you've been in touch with Extension, but so Carrie Weiner and I have, and you have been?
Yeah.
Okay. Then good.
Yeah.
Because Carrie and I kind of did we affectionately called the road show, where we went to some communities to talk about some issues. And in particular, Red Feather Lakes was pretty eye-opening of, I think there's a lot of desire there for, in a way, I think that there's a lot of people that are engaged, and I don't know that they know how to make some of the things happen that they want to make happen. And so I think that some guidance is really, good, because they talked about having a space where people could come together, and they do kind of have a space, but I don't know that they're utilizing it in the way that they could, and so there seemed to be, as we were leaving Red Feather Lakes, talking with Extension staff of thinking about really great ways that we could, kind of help people, like, kind of problem solve some of these issues. So especially around belonging and, that kind of stuff. So I think that, like I said, I think that there's a lot of potential there, but I think that the guidance would be really valuable. And I'm thinking about transportation is one of the things that you mentioned, especially in Red Feather Lakes, and I do think that that's an issue that they also brought up to us. And I would say at the regional level, we have the Metropolitan Planning Organization that does regional transportation planning, and there's Ride No Co. And there's been a lot of grants that have kind of where the MPO has been the sort of pass through for some of these funding opportunities, and there's a lot of vans and shuttles and stuff that have, especially Weld County seems to have been able to find funding for. And so I think that now, unfortunately, the person who ran the Ride No-Co program, Corey, he's leaving for greener pastures. But I think that they will be hiring for that. So, but if there's any way that I can help with any of that, we have a new MPO executive director. There's a lot of staff turnover right now at the MPO level, but I think that there are opportunities for sure for transportation with Red Feather. Like I said, I think we can learn definitely from smaller communities in Weld County of how they've been able to access some of that funding. So I think that there's tons of potential. Obviously, you're all nodding your heads. You're like, Kristen, you're telling us exactly what we're already doing and what we already know. But please let me know if there's any way that I can be helpful in sort of being a conduit between some of these groups, because that's a piece that I do know about, and I know that people do struggle with transportation. But yeah, and of course, Commissioner Cavales works with Red Feather all the time, and he probably has even more suggestions. So thank you. Thanks for the work, and this is exciting, and I think it's really great that we're sort of digging in to, find these gaps.
We are furiously typing notes, and we will be reaching out to, formalize or, that transportation up there. So thank you.
So I have a question and then a couple of comments regarding Red Feather Lakes. What are the zip codes that you are considering when you refer to Red Feather Lakes? Are you referring to Red Feather Lakes community or the larger area? So that's a question because they view it as a variety of zip codes that actually could encompass maybe up to 8,000 people. So what are you doing
The answer is, as we talked to folks, it became very apparent there was people just a few miles from, for example, the church where they're handing out food, that couldn't even get there. So we are definitely encompassing any and all zip codes up there, area codes. And our outreach would be intentional to expand that and integrate in their differing views on all of that.
So along with that, I'd like to have a conversation with you all, maybe tomorrow at the celebration, if there's an opportunity. It intersects with my conversation with Vanessa and community outreach, but I've had recent conversations with folks that are really moving forward on community-led solutions, and I wanted to bring that to your attention and some possible opportunities. So I'm hoping if it's not tomorrow, we could have a bit of a conversation of what's happening up there. And that includes Glacier View Meadows, Livermore, variety of places. And then
Great.
one other resource that to bring to your attention, if you're not aware, it gets to the transportation. I had a meeting with some folks. There's something called the Dr. MAC. Are you familiar with? It stands for Denver Regional Mobility.
Dr. Cog.
No.
There's Dr. Mack.
Yeah, that's quite all right. It's Dr. MAC stands for Denver Regional Mobility and Access Council, and they reached out to me. We had a bit of a Zoom meeting, and they're looking to expand what they do. You might look them up, what they do into Larimer County. And so I wanted to bring that to your attention. You can look at their website. And again, I had a good conversation. I think they're looking to do some kind of an announcement in January, and they're not wanting to, repeat what is already happening, but really work with folks and figure out where there might be gaps that they might be able to help with.
Thank you.
You're welcome. And of course, thank you for your work. Lorinda, is anything you'd like to share, and then we'll turn it back over to
When you
Heather.
mentioned being able to take advantage of the mobile unit, I wondered how these two, the strategic plan and this effort, tied together. And so I imagine the hub concept will be part of the outreach, that all of this is integrated into the bigger strategic plan. And it was great to hear that, that these aren't siloed programs, but these really are talking about the benefits across the organization with a focus on older adults in your particular case and your work. But certainly we know that they can access all the benefits across human services that you have to offer. So it was great to see those tied into this. And I think the collaboration with CSU is really exciting, be curious to see where it goes in the future, if you do a recheck in a few years, or, what happens from there.
Yeah, thank you for that. We actually have, Sam from CSU said it's never been done like this, so they've actually come back to us and sent us some student volunteers. And they're doing some projects with us. A student put that video together, and I just assisted with yet another project for rural outreach. So I think it's going to be well beyond today, that relationship, so, yeah.
Are there anything else you'd like to add, or any of your colleagues?
That's everything that we had for the agenda. I don't know if you want me to speak on the Medicaid piece just for a second. It's one sentence, really. We're waiting
one
to
sentence,
see.
really? So you asked me a question. Would you like me to answer?
Yes, please.
Thank you. You were answering it for me. Yes, if you can keep it to one sentence or so.
To change Medicaid to a block grant or to stop the waivers that are allowable today would require a complete change in the Affordable Care Act that might come, might not come. So there's a lot of unknowns that we're just watching. And we'll certainly keep you updated as we know more.
Absolutely. I'm glad you're watching, and I
Yeah.
would agree that there are a lot of unknowns. Yes, thank you. Is there anything else, colleagues?
I think that's it. We will see you at your holiday open house.
Well, and also there's the what is the event tomorrow, the celebration?
Tomorrow afternoon.
That's where I'm
Yes.
hoping we can chat a little bit. Let's see. So, thank you all. It's 11:52 a.m., and we are adjourned.
Thank you.
Thank you.